Okay, so good evening. Now I will check your letter. So we will start from here. Okay. So Dr. James Brown, orthopedic surgeon. Okay. Okay. This is good. So referring Mr. David Taylor, 38-year-old. Okay. So thank you for seeing Mr. Taylor as a new patient at your clinic. Write this properly. Okay. So he is 38-year-old male. So you already mentioned the date here in reference. So you don't have to write date again in the introduction because you already mentioned the date in that thing. Okay. So with complaint of left knee pain since 6 months. Okay. So how you can write it more efficient, like thank you for seeing Mr. Taylor as a new patient who has been suffering from left knee pain since 6 months. This is simple and secure. Okay. So next is body paragraph 1. Like this is your first paragraph, this is second, you can say that this is third. Okay. So Mr. Taylor was seen at my clinic due to left knee pain, due to left knee pain, due to twisting of it during tennis 6 months back. Okay. So you have used one thing two times in a one sentence. It is appropriate. What it is not appropriate when you are writing a professional letter. Okay. So how you can modify this line? How we can modify this line? Like you can write 6 months back, Mr. Taylor visited my clinic with left knee pain due to twisting while playing tennis. Okay, so this is also a good point to write this line. Okay. So we have to move next. So the next is he developed. What is the wrong? You started with small letters. Okay, so don't do that and start with proper capitalism. He he developed pain and swelling which initially responded to painkillers, but now he has developed, I didn't understand what it is, tenderness with slight swelling without a fusion which is restricting him to work productively, and he is worried of it as a result of low income. He developed pain and swelling which initially responded to painkillers. Okay. It is also not a appropriate line, so please send me case note as well so I can understand it more deeply. Okay, from next time. So what now he has developed tenderness with slight swelling with due to without effusion which is restricting him to work productively. Here is good. You should not include this line. Okay, so this is good, but I didn't understand the meaning of this line as well, and you don't have to include this line. Okay, and just from that to that. I'm sorry for disturbance if behind my area. Okay, so he has been on Naltron 50 mg BID. Okay, instead of that you can write twice a day. Okay, because the examiner who are assessing your ladder after your exam, they will not belong from medical profession. They are just English teacher. So instead of using these short forms, you can write twice a day, because they don't know the medical vocabulary, they don't know the medical words, VD, OD, TD, QD. Okay, so instead of using short forms, you have to use full forms like twice a day, once a day, thrice a day. Okay, you only use those short forms that are universal accepted, like BP, like UTI, and temp, and SAIDS. Okay, so you can write these short forms, but not all. Okay, next, for a week, X-ray. He has been on Norfrom 50 mg for a week. X-ray and MRI was done. Okay, so this is a new. This is a new sentence here. X-ray and MRI was done. Okay, so I would recommend you have to write it in a different line. You can write like, he has been on Naltron 50 mg twice a day. In addition, X-ray and MRI done. Okay, so you can write like this. Okay, so this is which may lead to osteoporosis. Okay, I will look forward to your expert advice. I can see that you are right. You have written this letter in very hurry. I can see that. So I would recommend, when you are going to write a letter, please make sure write it within 45 minutes. Okay, because you have 45 minutes to write a letter. 5 in which 5 minutes for reading and 40 minutes for writing. Okay, so second thing, I would recommend complete your ladder within 35 minutes. So at least you have 5 minutes for proofreading. So I just want to think about, like, I know that you have, I know you are aware about proofreading, but if you don't aware about proofreading what it is, so send me message, I will explain it to you. Okay, if you don't know what the proofreading is. Okay, so the next thing, this letter is very short. Okay, this letter is very short. This as a doctor, so you need to, if you want to pass your reading, if you want to pass your OET exam, you need to get B grade in reading, B in listening, B in speaking, and B in writing as well. So B grade is equal to 350 scores, or vice versa. 350 score is equal to B grade. Same thing. So to your this ladder, I will not give B grade. I will give uh, C grade to your this ladder. So I just want to recommend you, please write it. Write your letter with pencil. Okay. When you are going to write your letter, make sure you have 45 minutes, and you have to complete your letter within 35 minutes, and make sure you have 5 minutes for proofreading. Okay. So when you are sending your letter to me, make sure send case notes as well, and if need any help anytime, you can ask me, and join our OET talks channel. Okay, so take care for now. If need any help, text me.